We have 17 in the waiting room.
I think we can let them in, right? And
Oh,
then,
absolutely.
right, and then maybe hold
And
for a
then
few
we
minutes.
can chat through this.
And maybe give it 5
All right,
minutes
I'm letting
before we
them in.
start.
How you doing, Paige?
I'm good. How are you?
Good, thank you.
Very.
Screen is stuck. I'll start at about, I guess, maybe 6:35. Is that okay? Everybody?
Okay.
Give people a few minutes to get in. Hey, Lisa.
Welcome all our guests. We're just waiting for additional people to finish their dinner and come on board. We appreciate all of you being here at for this webinar and talk of a partnership. Welcome everyone. Again, we're just waiting for a minute or two for the room to continue to fill. We'd like to thank Dr. Michelle Miller and Dr. Richard Gallagher for coming tonight and talking to all of you. My name is Kelly Tebow, and I'm with the New Jersey Center for Tourette Syndrome and Associated Disorders. And you won't hear much from me tonight, but except here at the beginning and maybe at the end. We'll let the big boss, Ms. Pat Phillips, do most of the talking tonight. We'll give it one more minute. If everybody will familiarize themselves with the chat feature so that you can ask questions that way, or when we get to that point, you know, you could unmute yourself and ask the question. It's just that sometimes some people step on each other. So using the chat is another way of controlling.
I think we can get started. What do you think?
I think we're ready.
We're ready? Okay, great. Good evening, everyone, and welcome. My name is Pat Phillips, and I'm the Executive Director for the New Jersey Center for Tourette Syndrome. And we are so truly delighted to share with you this special evening with all of you. Together with the support of our board, we have embarked on a new partnership with our friends from NYU Child Study Center to not only bring you this webinar this evening, but to also provide comprehensive treatment and services for those living with Tourette syndrome in Northern New Jersey. This is truly a wonderful collaboration that we know will bring much needed help and support to so many families. And I really want to thank our entire board and all of our partners at NYU Child Study Center for making this idea come to fruition. Many months of talking and collaborating has brought us to this moment, and we are all so very proud to share this collaboration with all of our families, and glad that you're all here for this very important special evening. But before we tell you about the programs and services that will be provided by the Child Study Center, we're first going to begin with our webinar this evening. Our webinar entitled School Life for Children and Teens, Social and Executive Function Challenges. You'll also hear from our NJCTS Youth Advocate, and then we're going to open up for questions and answers. Once the webinar is concluded and we've finished our question and answer period, we're going to come back I'm going to talk about NJCTS programs and services, and then you're going to hear from our partners from the NYU Child Study Center. So before we begin, I'd like to say that everyone is muted at this time, and we ask that when the question and answer period begins, that you simply type your question in the chat, or you can unmute yourself, or you can use the raise your hand feature. Also, please note, the New Jersey Center for Tourette Syndrome and Associated Disorders and its directors and employees assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented here today. We do not endorse any recommendation or opinion made by any member, presenter, or physician, nor do we advocate any treatment. You are responsible for your own medical decisions. The presenters are providing general information and not any therapy, other health services. Thank you. Now it is my pleasure to introduce our presenters for this evening and also our collaborators on this wonderful venture that we've embarked upon, Dr. Richard Gallagher and Dr. Michelle Miller. Thank you both for being here. It means so much. This journey has been a wonderful journey with both of you, as well as Dr. Miserel, and we're glad that we're here today to see it come to fruition. Dr. Richard Gallagher is Associate Professor of Child and Adolescent Psychiatry and of Psychiatry at New York University Langone Health. He is also Director of Organizational Skills and Executive Function Treatments and co-director of the Selective Mutism Program at the Child Study Center at Hassan Fields Children's Hospital at NYU Langone. Dr. Gallagher is a clinical psychologist and neuropsychologist who has been treating and evaluating children since the 1980s. Dr. Miller is a clinical psychologist at NYU Child Study Center, and she specializes in the application of cognitive behavioral therapy to Tourette's disorder, obsessive compulsive disorder, body-focused repetitive behaviors such as skin picking and trichotillomania and eating disorders. And we will also hear tonight from our NJCTS Youth Advocate, Paige Kowalski, and she will introduce herself. So without further ado, I'm going to turn it over to our presenters. Thank you all for being here.
Hi, good evening. It's lovely to speak. So today I'm going to focus on beginning to talk about the connection between tics and social difficulties in children and teens. So to begin with, first we want to understand what is a tic. So we define a tic as at least in the clinical world, as a sudden, brief, recurrent, non-rhythmic stereotype motor movement or vocalization which occur on a background of otherwise normal motor activity. So we break up tics into motor tics and vocal tics. I'm going to go into briefly about what different presentations of tics and the tic conditions to understand that background in order to understand how tics can affect relationships. So although all tics in some ways are really all motor tics because they all require some muscle movement, for diagnostic categories, we break up tics into either motor tics and vocal tics. And we define tics as simple as versus complex. And simple for motor tics means that they're using more limited muscle groups and they seem not as purposeful. So very common motor tics are blinking, head shaking, facial grimacing, where you're like scrunching your face, tapping, tongue movements, jaw movements, shoulder shrugging. Those are some of the more common ones, and there are many, many other ones. Some of the more complex movements are actually touching objects, having combined tics, such as like shrugging, shaking your head and then shrugging your shoulders, tapping things a certain number of times, rocking tics, spitting tics, or even, which is unusual, but we hear about them in the media, is self-injury tics. And then some of the common vocal tics are sniffing, coughing, throat clearing, snorting, screeching. Those are the most common vocal tics that people experience. Less common or more complex vocal tics, which involve actually saying words, whistling, laughing. And although it's shown often in the media, it doesn't occur very often in at most 10% of individuals with Tourette's, but copropalia, which is cursing tics. But again, that doesn't occur very often. And so there are 3 different diagnostic categories of tic disorders. And when we're thinking of these tic disorders, an important thing to keep in mind is none of these tic disorders require impairment or functional impairment. So a person can have a diagnosis of Tourette's disorder and it interferes in no way in their life or functioning in any way. Or they can have the disorder and it's severely impairing. For many people, they're able to function really, really well without any intervention. Particularly, since for many individuals, this is primarily a childhood disorder that doesn't persist into severity into adulthood. So in order to meet criteria for Tourette's disorder, all you need is within a period of at least a year that you are presenting with at least 2 motor tics and 1 vocal tic. It's expected that the tics are going to wax and wane over time, but they need to be occurring for at least a year. And then if it's only motor tics or only vocal tics, whether there's 50 of them or 1 of them, if it's been a year, it's considered a persistent tic disorder. And almost always, except in very rare occasions, the presentation of tics occurs before age 18 and usually in early childhood. And if there's been any tics that are occurring and it's been less than a year, no matter how many tics are occurring, then they meet criteria for provisional or transient tic disorder. So interestingly enough, tics are heavily influenced by the environment. Although it is a neurological condition with, often, but not always genetic components, they can be impacted by things like getting enough sleep, being more relaxed. Whereas if someone, on the other hand, if someone's more stressed, if someone's more tired, if someone's switching to different environments, these things can worsen tics. Some people have what's called reflexive tics, where simply by hearing about a tic, they start to exhibit it. And it's not unusual for people to start ticking once they hear about a tic that they display. Now, tics can be suppressed, but only for brief periods of time, and it's really, really uncomfortable. It's like holding in a sneeze, or it's like if you've ever done a staring contest and you try and keep your eyes open as long as you can, it starts to get really, really uncomfortable. And at some point, you just can't hold them open anymore. And it's not very long. Maybe you hold them open for like a minute or so. And then when you shut them, you start like blinking and blinking and blinking because your eyes are just so uncomfortable. And it's a very similar sensation experience if you're trying to hold in a tic. There is often a warning sign, or what we call a premonitory urge, before someone displays a tic. The urge is often some kind of sensation in the muscle groups in which the tic is involved, but it can be more of a just right sensation where the person feels like they need to do a tic in a way that they describe as feeling just right. And sometimes the tic can occur in response to obsessional thoughts, but usually there's a physical urge that comes before them. So when we're thinking about how tics affect social experiences, there's a number of different ways. And it's important to keep in mind that just because someone has tics doesn't mean it necessarily affects their social experiences. I've had kids I've worked with where, they have plenty of friends, they've never experienced bullying, they're well liked, they do very well socially, they're very socially savvy, and the tics are non-impairing. But for some children and teens, it does affect their social skills and social abilities. So research studies looking at social skills specifically So individuals to be able to have good conversations, to know what to say, to know how to say it, to be able to build friendships and maintain friendships. Looking at those social skills has found that overall children and teens with tic disorders tend to have more difficulties with social skills. However, looking more closely at this research, we see that this almost always occurs when there is a comorbid diagnosis of ADHD and autism spectrum disorder, which we know can cause social difficulties. Such as like with ADHD, if someone is more impulsive, they say things more impulsive, they may say things more inappropriately, they may have trouble sitting still and sitting on a conversation and focusing on conversation, especially if it's not of an area of their interest. And then people who have autism spectrum disorder are born with, and experience throughout their life difficulties with communication in different ways. So of course, if you're having, those comorbid conditions, you're going to be more vulnerable. And then individuals with tic disorders are also more likely to have OCD and anxiety and mood disorders, which can also affect your social experience. If you're having repetitive thoughts, it can be difficult to focus on a conversation. If you're feeling down, it can be difficult or anxious. It can be difficult to feel motivated to go out and to be with friends. So there are many different ways that, having these comorbid conditions and the greater likelihood that those conditions occur with tic disorders can affect social relationships and social skills. On the other hand, for some individuals with tic disorders, even though they may be very socially savvy, they may feel really embarrassed by their tics, or they may have lower confidence about their tics. Some individuals have tics that are very frequent, whether there be vocal tics or motor tics or both, and they occur, while they're trying to have conversations with people, or if someone's really stressed, and then they start ticking more and they're trying to communicate with someone and then they're having difficulty communicating because of their tics, and then they get more stressed and then they tick more. These are just a number of different examples of how tics themselves can interfere with, basic communication. And some, children, teens may be so self-conscious that they're avoiding social events. And some social events are more difficult to do when you have tics, such as, if someone finds that they tick a lot, in like a movie theater, they might avoid going to movie theater with friends because they don't want to like tick in a place where they're expected to be quiet. If someone, may feel like they don't want to go to a certain after school activity if they find that they tick more during that activity. And so that can lead, because tics can change in different environments, children and teens may avoid them because of their tics. And unfortunately, some children and teens may experience bullying or teasing by others who may not understand their tics or may be struggling with their own difficulties. And that can, of course, lead them to struggle socially as well. So what can we do to support children and teens who have tics, who are having difficulties socially? And what can we do to prevent children and teens from having social difficulties? When we're thinking about what parents can do, one of the most important things is to ensure that your child understands themselves well, understands what their tics are, understands what, as much as it makes sense based on their age, the biological nature of tics, how they can and can't control them, what helps them get relaxed, what doesn't, what seems to make their tics increase and not. Help your children to feel confident that they know their body and they know how it works and they know their tics well. To talk openly and calmly about tics. It can be really helpful to encourage your child, even if they may feel self-conscious, to go into extracurricular activities that they enjoy and that they're passionate about. Interestingly enough, activities that require a lot of focus and motor control can actually lead a person to have a reduction of tics during that time because they're so focused on what they're doing. And so that can be a benefit. And of course, if it's activity that they like, if it's activity that they're good at, it helps build their confidence. On the other hand, even though you want your child to understand their tics, you don't want to give extra attention to the tics. You don't want to like be checking in on them every time they're having a lot of tics. You want to, not pay any extra attention to the tics, because interestingly enough, tics will increase if they're given extra attention. We want to instead focus and praise your child when you notice, different things that they're doing well in, to help build their confidence. And then if your child is having any social difficulties, being able to practice with them, having conversations back and forth, and modeling for them good interpersonal communication can be of good benefits. And then when we're thinking about the relationship between parents and schools, it's really important to incorporate advocacy, good communication between parents and teachers, and some, if needed, accommodations. So the parents and the child can help advocate for their needs in the school setting. And this will involve modeling, acceptance of tics, and if needed, providing education to classmates and teachers and other school staff about what tics are to help them understand it so that they know how to respond to tics. And there's greater acceptance in the school about tics. A parent or child could do this themselves, or through New Jersey Center for Tourette Syndrome, they can get an advocate to come into the school to do this. It's very helpful to have frequent communication between the parents and the school staff to let them know what tics are being seen at school and to understand what tics are being seen at home. And if there's a change in tics, let them know if they happen to be on medication, if there's any medication changes. Sometimes it can be helpful to have like a journal or a diary card that gets sent home. So there's that open communication. And then getting involved in the community, attending workshops like this to learn more about tics, and getting in contact with community organizations that specialize in supporting families with people with tic disorders, such as New Jersey Center for Tourette Syndrome. Some kids with tics, actually many kids with tics don't need any accommodations, but other kids need them, especially if they do have any co-occurring learning or emotional difficulties. So, there can be informal accommodations where, the teacher can just provide like a little bit extra support as needed or check in certain ways. Or there's formal accommodations, such as getting a 504 plan or an IEP plan, which would involve like the classification of other health impaired. If you want more formalized accommodations, such as getting extended time, then it can be helpful to request a meeting to discuss with school staff that you would like this plan, to recognize that you and your child are the experts of your child, and share information about your child with a team. Share their strengths and weaknesses, what their difficulties are. It can often be helpful for children to attend these meetings, and to make sure that you're getting copies of any evaluations and of meetings. Be sure to ask lots of questions to the school. In the school setting, just like at home, it's really important not to pay extra attention to tics. Even if you're like checking it, you're seeing them ticking a lot and you want to check in, are you okay? If every time they're ticking a lot that you're checking in, it's going to make the child more likely to actually tick more. So you want to not pay extra attention to the tics, but allow the child, if they need to leave the room. Don't ask them to leave the room, but allow them, if they want to be able to, such as if they can have a hall pass that they just have and they can leave as they need to. If they need a break be able to do some tics or to go into an environment if they're feeling overstimulated. And they may prefer to sit in the front or to sit in the back if one of those areas allows them to tic more or tic less rather. And sometimes the overstimulation of the hallways between classes can cause an increase in tics. So some students find it helpful if they can leave class a little early and get to the next class a little early to avoid that situation. And then a number of schools have social skills groups in them. They may also have speech therapists that help with pragmatic communication, which is social communication. And so you can reach out to your school to see if they have any social skills resources if your child is having difficulty in that area. Different schools have different approaches to bullying. If your child is experiencing bullying, it's really important, even before that, to have your child be able to have an adult that they trust in school that they can talk to about this. If there is teasing going on, to have someone in the school give direct supervision to the child so that they can, in a discreet way, so they can monitor and make sure that the child is not being bullied, and to monitor how the child's doing. To work with staff about how they will document and report bullying. Unfortunately, the bullying can occur on a school bus, so it's like in between the school setting. And so it's important to include the bus driver in discussions about tics and helping understand what they are, and ensuring that the bus driver is aware of children's vulnerability to being bullying in that setting. And then as far as like clinical interventions, so those are things that we do at the Child Studies Center, and there other TIC specialty programs can do as well. These involve, one is getting a full diagnostic evaluation. This is really important because if someone has a tic disorder, they are more vulnerable to having other comorbid conditions, like I mentioned before, such as ADHD, OCD, mood disorders, anxiety disorders. And getting a full diagnostic evaluation will help you and your family to understand what are these child's unique needs. And if they're having social difficulties, are they related to the tics, or are they more related to these other areas? And that will help determine if and what treatments is needed. Social skills training can happen in our setting. It happens in other settings as well. This includes social skills groups, as well as working with someone one-on-one to practice being able to have back and forth conversations and what skills are involved in creating and maintaining friendships. And then I'll talk briefly in a moment about Cbit, which is a treatment to reduce tics if someone is finding them impairing. And then medication can be helpful can't help with social skills, but it can help with reducing tics if they're impairing in someone's ability to communicate with someone. Or medication can also be helpful if someone's experiencing such significant anxiety and they're not responding to behavioral treatments. Anxiety is interfering with their social communication. So comprehensive behavioral intervention for tics is a treatment that's been heavily researched and has been found to be a way that individuals can significantly reduce tics, and be a tool that someone can manage their day-to-day tics that they have. So the components of Cbit are, one is providing psychoeducation, helping the person understand themselves, understand their tics, understand the biological nature of their tics, so they are an expert on themselves and they feel confident about their body and knowing about how it works. It also involves a functional analysis, which entails looking at whether there are different components in someone's environment that may be causing them to have increases in tics. So if someone is getting teased by a sibling every time they tick and isn't really ticking too much other than that, sometimes having a parent step in and reducing the teasing is enough for that them to experience a reduction in their tics. Some people primarily tick only under stress. And if we see through our function analysis that they are just having tics when they're stressed, we know that the main intervention then is to teach them ways to relax. But because so many people overall who have tics experience more tics when they have anxiety, we do incorporate relaxation training throughout this intervention. But the real crux of this treatment is the habit reversal training, which involves first choosing a tic that the person wants to work on and it would be helpful to reduce, helping the person become an expert on their experience of the tic so that they know when it's happening, and they may also know what the urge is, so they know when it's about to happen. And then you teach them to do a behavior that is incompatible with doing the tic. It's more comfortable than the tic, and it's less obvious than the tic. And interestingly enough, if every time the person notices that they're about to have this tic, they do the competing response. So for example, let's say that someone wants to work on a head jerking tic. If they instead, when they notice the urge to jerk their head around, they slightly move their chin down and hold that until their urge goes away, we notice that they experience a significant reduction in the urge to do that tic and the display of that tic. And for some people, the tic goes away completely. And so we don't fully understand exactly how this works, but we believe that by breaking up the cycle between the urge and the tic, that there is a reduction in that cycle and that the tic stops or decreases in occurring. And then the person also learns about how they would handle tics that occur in the future. And so therefore, even after treatment, they can develop their own competing responses if any tics occur in the future. As this treatment, although it can work on tics that you're currently experiencing, it can't prevent tics from occurring in the future. It's also important to note that because this treatment requires a lot of patience, a lot of body awareness, that this treatment is primarily recommended for individuals who are around 10 years old and older. But this is one way that people can feel like they can manage their tics and feel more confident, and hopefully help them in social situations if their tics are interfering in that way. All right, so now I'm going to hand this slide over to Dr. Gallagher, who's going to speak about executive functioning.
Okay, Dr. Miller, if you can stop sharing, then I can share my screen. Thank you. Okay, and good evening, everybody. Just to do a little bit of administrative work here, I may be talking about some things that are related to some royalties that I receive for books that we've written about some of these treatments for organizational skills in particular, and for also a measure that we've developed for that purpose. So I want to be able to just indicate that we do get some royalties for those, and that our research, in terms of some of the research I'll be talking about, has been supported by both the National Institute of Mental Health and also the Institute for Educational Sciences of the Department of Education. But the thing I want to be able to talk about today would be understanding a little bit about the academic and executive function issues and challenges that kids and teens with Tourette's might face. We want to be able to think about things with regard to Tourette's disorder and learning as a first step with regard to understanding some of the academic issues. So as it occurs, many children with tics are in special education settings or are getting special education supports. What we have found over the years is that Tourette's disorder is not associated with differences in general intellectual functioning. However, many persons with Tourette do have specific learning disabilities, including reading disorders, written language disorders, and also mathematical disorders. And it does appear that these brain-based conditions do go along with one another fairly frequently. Another brain-based condition that's also present with persons with tic disorder are persons that have attention deficit hyperactivity disorder, where difficulties with attention control and behavior control with regard to impulsivity and also level of activity are things that persons struggle with. And this is present with regard to persons having both Tourette disorder and attention deficit hyperactivity disorder. As many as 50% of those children and teens do have an additional learning challenge. A recent literature review has found that when persons do have some issues with regard to Tourette's, they do have problems with attention control, meaning it's difficult to kind of stay focused in class and that way. That there's often issues with regard to memory and retaining information or learning new information. And there can also be issues with regard to the executive functions, which I will talk about in general in just a moment. Here's the
Dr.
kind of
Gallagher,
yes.
could you put your presentation into presentation mode, please?
Sure. Let me just, I'm sorry.
If you go to the very
Yes, no,
bottom.
I know, I'm getting there. Thank you.
Okay.
Okay, there we go. All right, thank you. So again, so that these, in the center of some of these issues, as we said, is what has been reported. With Tourette's disorder being like a center issue, there are surrounding issues that can be present in a good number of people with regard to attention, memory, and executive functioning. And what we have found is that there's these comorbid conditions that do affect the executive functions. As I said, there's attention deficit hyperactivity disorder. And with regard to kids in the general population, these conditions are seen in about 8% of persons with tic disorders. However, if there's a clinical population, in other words, the kids that are really having significant difficulties with Tourette's and tics, they have a 90% possibility of Tourette's disorder, again, depending upon the sample that you've taken. So it does vary depending upon the sample and the studies that have been done. As I said before, it's been found that when kids do have both issues with Tourette and also attention deficit hyperactivity disorder, they do have some difficulties with academic performance than if they only have the tic disorder by itself. And there is a pattern that's found to be true for both children and adolescents, that if they have the combined problem, then it's more likely that these issues will continue into the adult years overall. And so we want to be able to keep those parts in mind so that when these comorbid problems are present, it does mean that persons have more challenges in general than persons without that. Now, what we want to try to understand is this topic of executive functions and understand exactly what is meant by that, and then to also turn to some of the organizational challenges that this can present in school during the elementary and middle and high school years. So there's been a lot of focus over the years on executive functions in kids with different neurodevelopmental disorders, which Tourette's is, finding that in psychopathology and neurological disorders, that there's an often inappropriate execution of behavior as being a component of these conditions. That in other words, these skills that people have for being able to control attention, for being able to kind of put together a sequence of behaviors, for being able to inhibit action, and sometimes being able to effectively use one's memory, are issues that have been found to be somewhat problematic for persons with these conditions. And so that as a group, not necessarily every individual, persons that are having trouble with executive functioning mean that they do have some trouble kind of carrying out tasks in a way that's smooth, efficient, and done in a relatively effective sequence. This can affect little behaviors like being able to get dressed, but at the same time, it can also affect complex behaviors like being able to organize oneself, or being able to pack up a backpack and remembering what to take to school, as well as being able to do things like get ready to prepare for a test, get ready to do other kinds of academic assignments. And it has been found that when executive functions are in good shape, it's been found that persons with these stronger executive functions, these abilities to kind of control and develop a plan of behavior and to be able to engage in that effective plan and use it in the right sequence, are persons that do have better success later in life. Now, we find that there have been some concerns saying, well, what can we do? We understand these executive function issues are a problem. Can we teach kids, and can we work on having them learn to inhibit their responses, that they learn to be more careful in their selection of responses? Can we have them learn how to use their memory more effectively for developing a kind of plan and remember what the parts are of a plan? And it's been found that kind of general training in this regard has been useful for kids that have backgrounds with limited resources. So it's mostly helpful for kids that come from backgrounds where they have limited resources in their family, limited resources in their neighborhoods. But with regard to actually helping kids out with attentional difficulties, it's been found to not really have a lot of major change, with the exception of different kinds of tasks that they're trained on. And so this is often done with regard to executive function training that's talked about, and parents often get advertisements about this to get involved with some computer training programs, to be involved with some video games that are involved with executive function training. But what's actually found is that kids do improve on these tasks and similar tasks, but they end up, again, not having much change in their behavior at school, in their behavior on their academics, and they're found to be a little bit wanting. So in terms of our research team, we were very concerned with regard to what we had heard a lot about with kids that are having some executive function issues, especially kids with ADHD, having many problems with regard to organization and addressing all the different school concerns. Our group is focused a great deal on elementary school kids. Other groups around the country have been focusing on these same issues in kids in middle school and kids in high school, with some smaller number of groups attending to kids in college having issues with executive functions. And what we found is that we thought a lot about this work with, again, especially kids with attention deficit hyperactivity disorder, because we want to be able to help this condition. We want to be able to help kids improve their school performance and not run into lots of difficulties. And again, if you turn to these executive function training that's generalized, it hasn't been found to be very useful. And that children with ADHD, and we do also believe in, with regard to some studies that we're initiating, that many kids with tics have some troubles with organization, time management, and planning. And we do know from some of the work that we've done, as well as persons around the country, that these poor organization, time management, and planning skills can impair kids' classroom behavior, their homework functioning, and we have found that they're linked to a lot of increased parent-child conflict when certain things happen, such as a child, saying, "Oh no, my what is due when and where is it?" A kind of kid losing track of understanding when assignments are due, what they are, and what the details are, and then recognizing that it's due at the last minute. We've also found that there's been issues with regard to kids having some troubles with backpack and paper organization, so that they often have exploding backpacks and difficulties finding things and saying it's in here somewhere, but not really having a really good, quick ability to get to things. And we have this kind of like method that can happen. In addition, there's some real issues with regard to time management, with kids often thinking and saying, in terms of poor planning about time, saying, "Relax, I have plenty of time to take care of this." But then when it comes down to the deadline, "Oh no, I can't get this all done. What happened to all of that time?" Having some real difficulties with this process. And what we've learned with regard to a good number of years of research is that we found that kids with ADHD and related conditions have evidenced significant difficulties with organization. In our own work, we see between 50 to 70% of kids in the elementary and middle school levels have some troubles in these areas, where there's problems with planning and completing some assignments, with managing materials for school and sometimes other activities. We find that the parents are often saying that we have trouble with the kids getting ready for sports and other activities where they sometimes show to the sport activity or dance class with one shoe because they have forgotten to organize their bags correctly. That the kids have trouble remembering tasks and also the associated materials. The kids often have trouble even going into high school, creating a schedule to complete tasks, with being lost when told you need to start doing a presentation and getting something ready for doing some work on an explorer or a famous scientist. And that the kids often also have a lot of trouble with keeping track of time and noticing how long it takes to do things. We find that these things have negatively impacted academic performance. And again, as I said, often creates lots of parent-child conflicts, with parents being really worried about kids and not understanding why can't you remember to write things down? You know, how complicated is that? And again, it's often with these conflicts occurring particularly around homework. We have found again in detail that these kids often misplace or lose materials. There's a careless approach to storing materials. There's forgetting about assignments and test dates. There's often poor time management, poor time estimation, and planning that lead to difficulties with starting or completing tasks. Oftentimes the persons who are involved with getting a really charge out of the starting blocks start and getting really good, but then kind of fading out as the project goes on for lack of follow through and difficulty knowing what steps to take next. And what we've learned in our research is that the kids have these certain patterns. What we did find is that kids do vary in their development of organizational skills, that some kids generally are able to pick up them. They watch others and they notice how they're doing, and they also listen to advice. But a good number of other kids have difficulty developing these routines. Some children may learn by verbal instruction and demonstration. Here's what to do with an academic planner. Here's what to do with kind of remembering what to keep in your backpack. Here's what to do to kind of break down a book report into different steps. But then we also think others probably require systematic instruction with reinforced practice. And that's led us into working on developing some efforts, but after finding out that these organizational problems are more common in boys, in kids with some special education or learning challenges, and definitely with kids with attention and behavior control difficulties and related disorders. We found in the work, in addition, that there are these 3 things that you can measure. We have a measure that we've developed for this that helps us understand things. There can be lapses in memory and materials management. There can be problems with task planning, with not thinking through all of the steps, but also not knowing how to put together the timing for the effort. And that there can also be inconsistent use of organizational tools, such as using calendars or folders, and kids like not necessarily coming up with good rough drafts for tasks. In general education, what we've thought about, and based upon doing research where we have conducted studies on developing and teaching organizational skills to kids, finding out that the methods are really very effective when applied with individuals, and some indications that these things are useful with teaching kids in small groups also. We've learned and give recommendations for teachers in doing this for the last 15 years, where we want teachers to think about really thinking carefully about providing instruction in organization in the classroom routine. We think that teachers can really take a good step by saying to kids, not just telling them, but saying, here's how we want to use a planner. And here, let's practice doing this at the beginning of the year, and let's get really good at understanding where we should write things down and how we should write it down so we clearly remember things. Here's what we can do with regard to taking care of our papers, in having a system that's not too complicated, but one that allows us to be able to find things easily in categories. Here's what might be able to be done to be able to help you remember what to include in your backpack so that you arrive to school with the things you need, and then you get back home with the things you need at home. Providing some instruction on time management. mostly with helping kids recognize how long it takes to do things and how adults think about spending their time and how they go ahead and go through a process of considering a task, considering how long the steps are going to take to do that task, and then figuring out when to fit it into their schedule. And we also think that in general, it's really helpful if teachers also explain to kids and provide instruction on how to plan. How do you carry out an investigation of a scientist? What are the big steps necessary to do so? And where do you turn for resources to be able to engage in that process? And how do you spend, again, your time in a way that you know how long it takes to do the research, how long it takes to do the write-up, and how long it takes to get ready to practice, let's say, a presentation. We think it's important to start early in these early elementary school year. And we've also been thinking that what's really important for school systems is to consider the idea about coordinating across the school years. Instead of having every teacher have a different kind of organizational strategy for how I let my classroom know what assignments are due, how I ask my students to be able to organize their papers, to actually think about doing it across all the elementary school years so that kids come to, from second grade into third grade, knowing what the school's general pattern is for kind of keeping track of papers and writing down assignments. And what we found also with regard to middle school and high school is that there needs to be time allowed during each class period for just the simple process of telling kids what their assignments are, because oftentimes the teachers don't give enough time for the kids to write it down. Or in the case of lots of virtual instruction, again, giving some instruction on how to use Google Classroom and how to use Google Calendar and the other places where kids find out information about what their assignments are and where they find the materials. We also think that we want teachers in general to recognize that there are differential abilities with regard to organizational skills, that some kids will learn this, students on their own, some students need brief instruction, and some students need guidance and supervised and supported practice, that it's not something that everybody picks up so easily. We do think it's also really important for administrators to think about building organizational training, again, for all grades, not to assume that these are skills that kids learn by osmosis, that many kids may need to, again, learn these things by having direct instruction. And also allow teachers to have their different styles, but again, to try to assure that they meet goals for improved training. That in other words, it's okay for a teacher to run a classroom differently and that there should be autonomy, but in general, to have some general goals of what the school is doing to be able to help kids manage and address these organizational challenges that are present throughout the day. And I'm going to talk about some ideas for parents as well. We think for teachers in special educational settings that it can be real helpful to conduct a functional analysis of, again, organizational issues. What does it take in terms of the school day? What are the demands for being aware of what your assignments are? If it's in person, what do kids have to do to be able to know exactly what their homework is and to know when tests are due? Is there something that they should be doing, again, with regard to writing down? If it is virtual, where is the link to be able to find out this information, and how often are you supposed to check it so that you know what you're supposed to do and when things are due? It's helpful to understand and say, well, what are the material management demands for each class? What do you need? Do you need a workbook for mathematics? And for doing English language arts, do we have to have a lot of handouts, or is there a book for that? When it comes to some of the other activities, what is required for music and art? And what are the kids expected to do to keep storing these materials and where to put them? What are the time management demands? When do kids really know how long it's expected of them to be able to work on items? And then what are the planning demands? If you're giving an assignment that is got multiple steps, are those steps spelled out? Or are the kids supposed to getting involved with doing that all on their own? We think it's important that, again, within schools that there should be ideas about getting parental support. And oftentimes it's helpful to let parents know, this is how we ask kids to keep track of their assignments. This is what we do, and these are the materials we hand out to kids. Please at home help your kids find a method and system for putting these practices into place. And then with regard to levels of care, with regard to things in the school setting, we really agree with the US Department of Education that says that when addressing concerns with kids, that you should always utilize empirically supported efforts that have really been tested out and been found to be effective. Now for parents, we do know that there's often an issue with regard to these executive functions, and that parents are often the ones that are guiding their kids, but gradually as kids get older, wanting to be the ones that turn this over to the kids. You know, we don't want to be in a situation as a parent to reminding kids all the time to brush their teeth, to get dressed, and to clean behind their ears. You know, by the time the kids are in elementary school, there's a kind of approach that says, we probably don't need to keep reminding kids of these issues. Well, this is often a situation that parents, especially let's say around middle school, often say, I don't want to have to keep reminding my child to have to write things down and to store the papers that they get, or you know, deal with the computer files in an organized fashion. But again, sometimes they have to do that. And when that's done, what we found has been really helpful is for parents to adopt a positive attitude. And that attitude often is one that recognizes that a child may not have learned these skills very effectively, or may not have practiced them enough to get really good, so that there's not a lot of struggle and terms like, you know, with arguments and scolding and saying, why don't you understand this? Why aren't you getting this? Because sometimes the kids truly don't understand it and really need some instruction as well as a lot of time to practice. We think it's really good for the kids and parents together to work with the child to develop a set of effective routines for all the organizational demands that they face during the school day. And so we find in general that if the kids see difficulties and if they see them as challenges to overcome rather than faults to repair, that makes a big difference. In other words, it's not a good idea to be critical of the kids and say, this is really wrong. You're mature enough to be able to do this on your own. It's really wrong to do, you know, be in this position. We think it's better to be able to say, you know, look, we're noticing that you're having trouble making sure that everything gets in your backpack at school, at home, and that you seem to keep forgetting your lunchbox, or you seem to keep misplacing your math workbook, so we can't get you to do your math at home. So having the parents and kids together kind of say, you know, this is a real challenge, let's work on it together. That plays a major role in helping the kids function effectively. And we do recommend a couple of different routines that come from our work that is, again, as I said, an individualized kind of treatment for this. That if parents do a couple of things before needing treatment, it's worth trying these things out. So we think in general, a caretaker or a parent, whoever is involved with the kids around thinking about their homework, to set aside a brief period of time each day to check in on the child's assignments, tests, and grades, and kind of see how are things doing and how are you managing your day where all these things are falling on your shoulders. And to also then think about this routine and to be able to start to think about perhaps doing things one step at a time. So perhaps, again, maybe at this part of the year, getting really clear about, do you know what your assignments are? Do you have a method, and do you have a tool for writing things down? Do you know if you're getting a lot of information virtually? Do you know how to get to those websites? Do you know how to be able to keep track of what it is that you're supposed to be doing? And how does your teacher actually use this method? So thinking about that. So all in all, kind of like setting up a first time to be able to say, let's talk together about the nature of your organizational demands, and let's be clear about it. Let's have a kind of check on this every day. We think the other thing we want to do is to kind of think about consider the typical day. What organizational skills do kids need to be able to put together from the beginning of the day to the end of the day? So for example, in the beginning of the day, at home, it may be, you know, understanding, okay, what homework did you have last night? Is the homework put into a place where you can easily turn it in? If you did have to do things virtually, did you submit it? And did you make sure that you submitted it? Now, as we get ready to pack up and go to school, let's think about your backpack and let's take a look at what needs to be in your backpack. And maybe we need to work together to come up with a reminder list for your backpack that is pinned into your backpack and used for you to kind of see and say, okay, do I have all my papers? Do I have my assignment record and my assignment pad? Do I have the workbooks I need? Do I have anything extra such as sneakers for gym class? Or do I have my instrument for music lessons? And do I have all the other needed things that I need for the day? And then work on helping the kids come through a process so it's like at the front door, ready to go when they leave to go to school. But then thinking within school, having them wonder about, well, when you're in school, what do your teachers do in terms of giving you information about what your assignments are, and where do they write it down? And what do you need to do to be able to make sure you have this information in a record that's not just in your memory? Don't rely upon your memory only. And then beginning to consider with regard to homework. How long does it take to do homework? And being able to get a set idea of like estimating when homework should be done and when it should fit into the schedule. Is a day when they have basketball practice a day when they can get ready for studying for a test, or is it a day when, in fact, you can barely get your homework done because your schedule is so tight? So we need to think about spreading out the preparation for a test on the other days before basketball practice comes around. Just kind of like getting a good, thorough review is really helpful. And thinking about, again, the very practical aspects of like, what do you do to get out the door? What do you do to kind of get back into the house, ready to do homework in a reasonable amount of time? Our work is very stepwise designed this way. And what we found is that when this work is done, it's improved kids' organization, time management, and planning behaviors, that it has improved the kids' academic productivity, it's improved their academic performance, and it did decrease significantly homework problems and family conflict. So teaching kids and having kids learn these skills is something that can improve functioning all around. Now, here's some more further contact information that you want to be able to have. We'll talk about those things in a moment, but I think we want to be able to hear at this time, and I'll stop sharing my screen for being able to get back to the presentation so we can have and hear from our advocate.
All righty, thank you so much. All right. All right. I am Paige Kowalski. I'm a freshman at Marist College, so I'm 18. I was diagnosed with TS when I was 7. My tics were fairly mild back then, but now is another and pretty different case. I was diagnosed by my neurologist, who had an easy diagnosis because TS ran in my family and my sister had it as well. So originally my main tic was to make painful popping sound in my throat and my mouth. And now my tics include dislocating my shoulders, hips, knees, jaw hundreds of times a day. And this has obviously caused chronic pain and stretching of my ligaments and joints, which led to a diagnosis of Ehlers-Danlos. I'm always very open with new people I meet about my Tourette's, but not everyone is able to immediately feel comfortable enough with peers to disclose what affects them. The openness that I have has led to many friendships and compliments on being able to express myself diversely, but it's also led to a vast number of judgments made about me. All of my friends are so supportive of my random squeaks or twitches, but sometimes strangers aren't, which is why I speak so honestly about my experience. So I've approached TS from many different angles: physical therapy, medications, habit reversal therapy, and more. While these things have helped my pain at home sometimes, being at school is a different story. So a little bit about my academic background. I started out as a homeschooler until about 5th grade when I went to my mom and I asked to try something different. I was happy in school until about 8th grade when my tics really started to take off. That was the peak of my pain. My dislocation, squeaking, and twitching made me a distraction in class and an impossible participant in gym. My guidance counselors were very accommodating, making it easy for me step by step out of the room and get notes written for me when my TS acted up, but it still felt ostracizing. Within a student body, it's really important to feel wanted by each person there, including the administration. So I switched schools in 10th grade to find more comfort in a VOTEC theater program, but found the opposite effect, unfortunately. I struggled more. My counselors had less understanding of who I was and what I needed to succeed in the classroom. Each day it felt like I was pushed away from the group more and more until the student body joined the administration with its confusion of my needs. I was bullied and left school in the beginning of 11th grade, continuing education on my own. Socializing with new people elevates my anxiety, causing me to tic more. I'm quick to explain why I do the things I do and that there are others like me, but many times there is a look on the person's face of confusion and concern, not interest and comfort in my presence. To those who have looked at me like a ticking, no pun intended, time bomb, it is understandable. I'd be confused if my new coworkers started making guinea pig noises at customers too. Although I forgive those who are confused with my situation, it is hard to forget the mark made on me and how unwanted I felt. Doing talks like this and openly answering questions makes me feel like there won't be others who experience what I did, and that there is a wanted place for us in schools and other areas of our interest. For example, for me, that's theater, my youth group, and classrooms in general. And obviously, that was a very shortened story. And I'd be happy to answer any questions you guys have or elaborate on anything you guys would like me to.
Thank you so much, Paige and Dr. Gallagher and Dr. Miller, for this wonderful presentation. And we do open up the floor now to questions from the audience. Feel comfortable to type your question in the chat or unmute yourself or use the raise your hand feature. We're open to questions. No questions? Well, I definitely have one. If anyone doesn't have a question.
I have a question. Sorry, I can't find the raise your hand feature. I apologize.
Okay. No problem. Go ahead.
Okay. Yeah, my name's Jerome Keeler. I live in New Jersey. Paige, did you have comorbid conditions? ADHD, things like that. Did you struggle with the executive functioning? And if so, how did you manage? How do you manage now?
So I think my main issue right now would actually be my ADHD. I would say in middle school, my depression, anxiety were a lot more forefront in my issues. But right now, I think my ADHD is taking precedent over that. It is very hard for me to keep focused along with my TS and my ADHD. So what I do is I tend to write things down in my notes app, like as soon as I hear it. Just like keeping track of what I'm doing to help me develop that routine in my head, because it is really hard. I'm also taking medications for my Tourette's right now, so that's pretty helpful, and I just have to focus on my ADHD. But yes, I did struggle with quite a few things, as well as my Tourette's as well, and they definitely exacerbated my tics at most points. But I would say my functioning is reliant on a lot of what I do to remember what I have to do, because that is a big issue for me. When most of my tics are physical, I'm moving around. So it's very hard for me to keep my brain in one place when my body is everywhere. So yeah, writing things down was really helpful for me. I did a bullet journal at one point, but yeah, just keeping track of everything I have to do, calendars, stuff like that.
Thank you so much.
So there's another question. How, and I'm assuming this is for Dr. Miller or Dr. Gallagher, how do you help a child develop time management, organizational skills without fighting?
Well, we really tried very hard in our program to work this out, because many of the kids we've worked with, in terms of the research work and clinical work, we've worked with over 300 kids and their parents. What we found is we try to be able to make it clear that we don't believe that the organizational skills and these time management problems are the child's fault. We try to be able to make it clear that this is something that we think, and we describe this as being something where there are certain glitches that pop up, and we put them in the form of like little characters that give kids some mischievous messages that we want them to work on avoiding. Something like, well, I don't need to write that down, I'll remember it later on. What we call the go ahead forget it glitch. And if the kids follow along with that idea, then the go ahead forget it glitch is really very happy when they get scolded and they get told, why didn't you write this down? This is a real big problem. You keep doing this. And what we want parents to do is to be patient. We want them to say, okay, this is a problem we need to work on together. So let's figure out a strategy. Does your teacher have you, write things down? And does your teacher tell you at a certain time of the day to write things down? What is it that you need to have in your backpack? And let's work carefully to make sure you have a reminder list for your backpack. When you are given an assignment for doing math, let's think about it carefully together. Let's spend some time calmly, and let's sit and listen calmly. Let's work in a way to say, well, how long do you think it's going to take to do this math? And let's think about the family schedule for tonight, and let's figure out when you can fit it in. I think it does take time to build the skills. We want to be able to have everybody think about this as being a process that needs to occur carefully. And we want to do something that Dr. Miller mentioned about, looking to see what the kids are doing and noticing the things that they're doing and positively praise it. So if a child is sitting and getting ready to listen and is like, being willing to kind of say, okay, let me know what you think I should be doing. And even if they show a scowl on their face, even though they might be like, fidgeting around and moving around too much, it's like a parent should be saying, I really like that you're sitting and listening. I really like that you're willing to have a beginning discussion about this, as opposed to the kinds of, frustration that the kids might be presenting in another way. With regard to this, if we do think that families can work to be able to help do this on their own, but if not, we do have treatment available for this, and helping parents and kids do get better at this. Those are some things we think that are useful for dealing with this.
Thank you.
Oh yeah, I see.
Cindy, go ahead. Go ahead, Paige.
Cindy had the raise hand feature, I think, a little before. So if we want to take that one first.
Yeah, Cindy K, please unmute yourself and ask your question.
Hi, I was wondering if you come across the experience when you're trying to train to go through how to plan and do things. I kind of call it oppositional defiance, where when I try to help or suggest, I get no, you don't know, you don't understand. So I kind of feel like I'm, the teacher on the peanuts, and when I speak, it's like wah, 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 wah. And I don't know how to get around it.
Well, again, sometimes what is helpful is to really, sometimes I think what's important is that families can be trying to do their best and kids can be trying to do their best, but if it's not working out, it's often a good idea to see about getting help. And this is one of the reasons why we developed our program and why other people develop programs for older kids as well, to kind of help families and kids do better. But if before that, a lot of times what's helpful is to just see about, please just listen to what I'm suggesting. Please don't necessarily agree that you have to do it this way. And if somebody says you don't understand, I think it's often a good idea to just ask the question and say, what don't I understand? What's going on that is presenting such a problem? And if you kind of practice over and over again this process of being ready to listen without interrupting, without criticizing, then sometimes you get more information, and that's often something that's worth helping. But it's a difficult task. Everybody's concerned about getting things done. The kids don't want to fail. The kids want to be able to succeed, but sometimes they don't quite know how to do it. And if they explain, what they're doing and why they're struggling, they're often afraid that they're going to be further criticized. And so I think we have to be really careful about those kind of communications.
Thank you. That was very helpful.
Go ahead, Paige.
All right, so the question was, me and my family decided to go the homeschooling route, and looking back, what did I wish my school did for me? So I think the main thing was that in middle school and elementary school at my original district school, I had a really good guidance counselor who helped me start my 504 process really early on. And that was very, very helpful. And once I moved over to the VOTEC, they had that 504 and they were aware of it, and they definitely had it on file and were trying to accommodate things for me. But their attitude was very dismissive, as I was a new student coming in 10th grade. They didn't know me at all. It was really hard for me to meet with them. So I think to accommodate more for students in the office who might have problems with attention or just sitting in class, or especially mobility in gym. They were very dismissive of it. So I think my school could have done a lot more in actually engaging with me to see what they could do to help their students. But yeah, I would say that would be the main thing that I wish they'd done.
Great, thank you. Christina Ordonez, do you want to unmute yourself?
Yes. Yes, can you hear me?
Yes, we can.
Okay, so my question is for Dr. So I have a 9-year-old, and I sit with him after school to complete, classwork and homework and study for tests. But the minute I leave the room, he moves on to do other things. Sometimes I feel that I'm building a codependent relationship, or is this normal for me to be assisting him because he's 9, or am I creating a codependent relationship for him to be able to complete a school work?
It's a balance that's hard to keep up with. You want to be able to have your child do well at school. You want to be able to have your teachers be able to say, the work's done, that's great. But it can develop into a kind of codependency. Unfortunately, I've met persons like Paige in terms of being in college, whose parents have helped them all the way up through high school, not wanting to let them trip up, and they get to college and don't know how to function. So it is a difficult balance. And sometimes what can happen is that real issues with attention might be the issues that are getting in the way. So sometimes finding a real clear assessment of attention concerns and options for treating those might be the way to go. And that's an important part of the process of figuring out what your child's needs are.
And another question, I was informed that you are located in Hackensack, New Jersey. Is that correct? Are you taking any new patients at this moment?
We have options for doing some of that, and that's part of what we want to be able to talk about this evening.
That's amazing. I'll be interested if I could get your information, where to call to book an appointment. Thank you.
Okay, great. We have a question, and I've kind of lost it, about a 17-year-old who the text said he is good at planning, however, he is not good at the execution. I'm trying to find it. That's my apologies. Things came in quickly. So when is it time, unless mom is constantly checking on him, things aren't getting done. When is the time to back off? They've practiced many of the skills you've suggested with planning and organization for years. There we go. Thank you.
It is a question to be able to turn the responsibility over to the 17-year-old. But again, sometimes if you've been really struggling for a time, it is often helpful to begin to look for some guidance and some assistance in that regard. For older persons, it's often helpful to find out what the barriers are and to do a kind of objective review of saying, well, okay, so you do know what your plan should be. You do know what the steps should be. What trips you up when carrying it out? And sometimes it is getting distracted. Sometimes all different variations. Sometimes people are discouraged. Sometimes they say, I'm really not quite sure exactly how to carry it out. And they lose motivation. Usually a good, careful review can, find out what some of those barriers are and try to see about knocking them down. But even 17-year-olds and persons a little bit older often need a lot of practice to be able to, reflect on themselves and how to set up their environment and how to figure out what skills will lead them to follow through more effectively.
Do you have any information for a high school program for executive function?
So I'm sorry, I don't want to, I hope Dr. Miller can, jump in at times as well. There's been research on elementary school. There's been research on middle school. High school is an interesting little wasteland where it's being evaluated. And we think that the most effective thing to do is to use some of the ideas from the middle school programs and some of the ideas from college programs and, put them into place with some individualized treatment that comes up with a program for an individual kid. But right now there's no tested high school program.
Okay, thank you. Does anybody else have a question?
I see 2 questions in the chat.
Okay.
Yeah. The first one, for the 9-year-old son who knows that he has tics, I would say I wouldn't give any advice on how to do it, but I would definitely say that when I was diagnosed with TS, it was definitely like a thing that my parents made a happy day. So they told me, and they had a very excited outlook on it because my sister had also been diagnosed, and it is a scary thing, but I think that understanding that they were happy that I was unique and I was strong really helped me, because I think if they had approached that in a different way, I would have struggled a lot more. But when I first got my diagnosis, me and my family did a little cheer, and me and my sister hugged, and she was like, welcome. So it was definitely a positive experience for me. So I would definitely say that instead of a negative experience where it's kind of this is what you have, I would definitely approach it from a more positive way, because that is something that I remember since my diagnosis. And the second question, how is homeschooling working for you? Was it difficult to stay on top of your work? And did your parents have to help you stay focused? So when I was little, homeschooling was great because me and my sister would do it together. And then once I started doing homeschooling in high school, it was a more hands-on project with my parents, just because there are legal aspects that go into it to make sure you're taking enough classes and getting your credits. So it was difficult for me to stay on top of my work, but I think a lot of it helped me prepare for college a lot more than I would have been prepared if I had just been taking classes at my district. And it was very helpful for me because it helped me to build those skills that we talked about kind of in a dependent way before college, where it would really crack down on me. So I thought that that was really beneficial for me.
I'm going to jump in.
And
I
thank you.
see, a question about about someone wanting to know if they're, about encouraging their fourth grade daughter to talk about their TS with their school. At this age, I think it's really hard for children to advocate for themselves and to stand up and to say they have TS. I think, for some students, they're very open about it and they're very comfortable with it. If she is anxious about it and doesn't want to do it, I would let it go. It's really important that it's a collaborative process where the goal is to make the school environment more comfortable for her. If she feels like doing this is going to make her more uncomfortable, then you want to avoid that. However, there are some alternatives. You can have someone from New Jersey Center for Tourette Syndrome, like Paige, come in and speak about what it's like to have Tourette's. And it would be just she wouldn't come in and say oh, I'm speaking because this girl has this, your classmate has TS. They come and they say, this is just an educational program to help to teach everyone about this condition. And so that can be really helpful to hear from a cool teen or college student about TS. And then, it takes the pressure off of your child to talk about it, and then helps other kids understand it without singling out any students.
Okay, great. So somebody asked, is there a program to get a blood test to see if they carry the TS gene? there is a Tourette syndrome genetics collaboration, and I will at the end put in a link to a flyer. It's ticgenetics.org, and you can get some answers there as far as the genetics and Tourette syndrome.
And I want to note with that there's multiple different genes involved, and they're finding different genes are associated with different families. And they haven't identified like every gene. And also, just because you have a gene doesn't mean that you'll have that, you'll have tics. But it is really interesting research. And especially if if you're in a family and there's multiple members that have TS, it's great to get involved.
Camille, go ahead and ask your question.
Hi, this is Christian, Camille's husband, Dr. Gallagher, Dr. Miller. It's really sweet to see you guys. It's really nice to see your faces. There was a recent phenomenon that is being studied about TikTok videos causing tic disorders in young girls. I'm interested in the idea of, will there be a study as to what is causing it and potentially reversing it that could potentially find some kind of new treatment in the reduction of tics in Tourette syndrome? Something that came to my mind is if they solve that for those girls, if they're truly exhibiting these tics disorders and it's persistent and they can't get rid of them, if they find a way to reverse it, would that maybe potentially give some new theory or information to people diagnosed with Tourette's?
That's a great question. So, so some background information. So recently they found that a study came out saying that they've looked at TikTok videos and found that these teen girls who were often on TikTok, the average age was 18 years old. And if you think about, as I said before, like it's usually something that is presenting earlier in childhood, but they're presenting with tics. And the presentation of these tics are different than in typical tic disorders. Mm-hmm. They're more extreme, more severe, more involving of self-injury, more involvement of arm movements, more frequent. It's a very different presentation. And so this is different than a tic disorder. In a tic disorder, there's a biological component. You're typically seeing a presentation of the tics around like 5 to 7 years of age. You see an increase usually around the teen years, and then it often like tapers down. And then, or for around 30% of people, it continues into adulthood. This is actually different. It's what we call social contagion, where it's just like we've heard of conditions where, like, for example, I think it's like in the 60s or 70s, a book came out about dissociative identity disorder called Cbit. And after that book came out, a number of people reading it started to claim that they had alternate personalities. And some people really believe that they did just from being exposed to this.
It would make sense to me that it would lean towards that type of phenomenon. I get that.
Yeah. So what we're thinking of as addressing this, I think I tell everyone this, like social media is just problematic for mental health. And I understand that in this world, it can be hard to get off it. But I think, if you're showing like a behavior disorder, mood disorder, mental disorder in response to social media, it's important to cut that out, to cut off social media and to find alternatives. I think overall limiting social media is just so important for mental health. And then, in addition, people who are experiencing, these social contagion likely may need some help with some other, conditions that may be like underlying and making them vulnerable to the experience of social contagion. But it's not like a true tic disorder. It's just like a more of a unique social phenomenon.
Understood.
I'm going to say Thank you all, Dr. Miller, Dr. Gallagher, for that wonderful presentation. Paige had to leave, and we thank her as well. And she put her email in the chat if anyone wants to reach out to her with any other questions. I want to make sure that we get to some of the more tangible pieces of the presentation so that we can talk about the collaboration with the NYU Child Study Center. And just briefly, I'm going to just give you some news and updates and information about the New Jersey Center for Tourette Syndrome. I just want to mention that we do have an education outreach program, and part of the education outreach program includes our webinar series, where once a month on Wednesdays at 7:30, we conduct webinars on a variety of topics, not just Tourette syndrome and the associated disorders, but on a variety of topics. We've done stuff on Cbit, game-based cognitive behavioral therapy, parenting, bullying, suicide prevention, a whole lot of different topics, and they're done by well-trained clinicians in their field. Please go to our website and check out some of these webinars that are archived. And if you're a teacher in the audience there, we do give professional development credit for teachers. Part of our education outreach program also includes going into schools and community organizations and presenting around TS and the associated disorders. We also have our youth development program where you saw Paige. She's one of our youth advocates, and she goes into schools like Dr. Miller mentioned, can go in and speak to a classroom or go into communities to talk about the challenges of living with TS. And we also have our Tim Howard Leadership Academy. So any high school students entering their sophomore, junior, or senior year in 2022, please apply to the Tim Howard Leadership Academy. It's a wonderful opportunity to not only learn more about Tourette syndrome, but also to engage with other young people who are going through the same challenges that you may be facing on a day-to-day basis. And we also have coming up in June, our in-person family retreat weekend. So we're happy to say that we'll be back in 2022 at Black Rock Retreat in Quarryville, Pennsylvania, June 24th to June 26th. And registration is you have to register by February 15th in order to save your space at the family retreat weekend. Again, that'll be a great opportunity for families to get together and connect, and for our youth to connect with other youth as well. Also, just want to point out that when you call into the New Jersey Center for Tourette Syndrome, we can refer you to all types of neurologists, psychologists, psychiatrists that work with people with TS and the comorbidities. But also now part of that will be the NYU Child Study Center. And I'm going to say that we still have research going on at Rutgers. So as Kelly mentioned, you can find out more about the research. All this information is being put into the chat. And there is still a clinic at the Bushwick campus, the New Brunswick campus at Rutgers. But we now have also this wonderful collaboration with the Child Study Center in Hackensack, New Jersey. I'm going to turn this over to Dr. Gallagher and Dr. Miller to really talk about the services and programs that you'll be able to get there at affordable rates.
And here I have just a contact information slide to be able to indicate some things. And this has been something that was placed in the chat so that the slides are available. But the other part I want to be able to say is that with regard to what we've been discussing with the New Jersey Center for Tourette Syndrome is to work on basically making sure that families understand that we do have some services available, that those services that are available are ones that have to do with all of the different indications that we provided. So we are looking to do this with graduate students in psychology so that this allows us to be able to provide services at a reduced fee. The services include evaluation services, including understanding the nature of Tourette syndrome and looking for a diagnosis. It also involves neuropsychological and educational assessments. And then in addition to that, we also will be offering treatments, a cognitive behavioral intervention for Tourette, the comprehensive behavioral intervention for tics, treatment for the comorbid disorders, including the different anxiety disorders. We do offer organizational skills training, parent training, and then also school consultation. And in addition to this connection that we have in our Hackensack office, the NYU Child Study Center and New York NYU Grossman School of Medicine has been designated as a Tourette Association of America Center of Excellence. And as a result of that, the New Jersey office allows us to be able to help people make consultations in the medical consultations in the Manhattan office for psychopharmacological treatments and some of the different other medical treatments that are being tried out, such as botulinum toxin injections, and in fact, a group of people that are doing some things for very severe conditions, including deep brain stimulation and neurosurgery. And in addition, we will be participating in the educational programs on Tourette disorder. So the program is something that we have available starting now. I do need to say that one thing that we want to be clear about is that we don't want to overpromise things. As many people know, during the COVID situation, mental health services are being overloaded. We will do our best to be able to help people make connections. But with regard to the student trainees, we will be working on building this service up so that more and more families can come to see us for these relatively low fees. We're talking about fees that right now are being designated for individual therapy or any other kind of contact that is about $50 a time point of about 45 minutes to an hour, which is really a significant discount and is being provided by students that are strong students being supervised by our faculty members. So this is something we are really very excited about doing, and we've been working on having this worked on for a couple of years, and we're very happy to have this announcement to bring this out at this time. And Dr. Miller, do you want to able to add anything? Did I
Yeah, no, I think you covered this really well. That we are, and a number of us are certified in comprehensive behavioral intervention for tics, that we received the full training, and we because we all are pretty in one house. If you're seeing one of us for therapy, another one from us for psychiatry, you knew that we're always in touch with each other and collaborating, which can make it very, very helpful in ensuring that the treatment is comprehensive and addressing all the needs of the individual. Any questions about this?
That we have a question here. Yes, we want to be able to clear with COVID, we have been providing services virtually as well as in person, so that we are able to do that. And again, we are aiming to be able to help people in northern New Jersey, but we can provide these services throughout New Jersey because of our licenses that are for the whole state.
No more questions? Well, if there are no more questions. Of course, if you do, you can always reach out to us in the office. Call into the office. We have our website and we have our email address, and Dr. Gallagher has also put in the contact information there. So we can still continue to answer your questions. If you think of something tomorrow morning that you did not ask here, please don't hesitate to reach out. And we just thank you all for being here for this opportunity. And we look forward to working with you and staying connected. Thank you
thanks,
so much,
Pat, for helping to put this all together.
Oh, no, thank you so much. It's a tremendous presentation. So much learned here. Really appreciate it. Take care, everyone. Have a good night.
Good evening. Thank you.
Good night,
Take care, all.
Bye-bye.
You have to end the meeting, Pat.
Okay. I'll end it for all of us.